everyone, and welcome back to Free Your Mind Friday. I am Dr. Natasha Gettings, and I'm excited to talk about this topic that I've selected for today's video. It is a topic that hits pretty close to home for me and probably for a lot of you as well. And that topic is dementia. As we look forward to March and we learn more about the importance of maintaining our brain health, I think it's very important that we discuss some of the major diseases that cause some of us the functions of our brains. So if we look at the incidence of Alzheimer's here in the United States, it's pretty obvious that this is a growing epidemic, and it's estimated by the year 2050 that Alzheimer's rates will increase significantly. And so there is a lot of information here that I want you to pay attention to and also pass on to others so that we all can be an informed community when it comes to maintaining brain wellness. So first I want to just talk about the term dementia. Some people use the term dementia interchangeably with Alzheimer's disease, and they are not in fact one and the same. Dementia is kind of your umbrella, so there are many different types of dementia that fall underneath that title. And before I move forward, I do want to say that it is really important for me to dedicate this video to my grandmother, who I lost from Alzheimer's, Eleanor Lee. And I'd also like to dedicate this video to Dr. Frank DeLaurentis, who was a colleague of mine practicing in Orland Park, who recently passed in 2016. And he dedicated his career to treating patients with dementia diagnoses. He was a geriatric physician, geriatric psychiatrist. For those of you who remember, I explained in the previous video that there are different specialties of psychiatry, and geriatrics is one of them. So I'd like to dedicate this video to them and proceed with my effort basically to educate the community about how to avoid having this disease occur in your family or in you. So moving forward, if we look at dementia, we can identify different types of dementia. The most common type of dementia is Alzheimer's, and that is also accompanied by vascular dementia. For those of you who are familiar with strokes, when people lose blood flow to the brain, when they have vascular disease, basically when their blood vessels are not healthy within the brain, they can develop symptoms of dementia. And so the take-home lesson there is that our central nervous system is closely tied to our cardiovascular system. If we don't get good blood flow, then the cells in our brains, also known as neurons, can't do their job. And so dementia is basically a word that describes the process by which a patient or person loses neurons. They lose brain cells. We refer to that in medicine as a neurodegenerative process. So you have degeneration of brain cells. Neurons, in order to function, need lots of things. They need oxygen, they need blood flow. So it's important for us to understand that when we are trying to prevent dementia, we have to make sure that we have a healthy cardiovascular system. Now, Alzheimer's and frontotemporal dementia, Parkinson's disease, those are all slightly different disease processes that cause the onset of dementia. When you think about dementia, you should think about a few major categories of loss of function. So one major category that we see decline in mental functioning when a person is diagnosed with dementia is their memory. That's the one area that I think most people are familiar with. But you also can see a decline in communication and language. You can see a decline in reasoning and judgment. You can also see a decline in a person's ability to maintain focus. And so I'm sure all of you who are motivated to live happy, long, and healthy lives can understand why trying to avoid dementia might be something you want to put on your agenda, because to live here and to be here around family is one thing, but to do so in your right mind is something else. And so I'm sure all of us have witnessed the differences between those who are able to age and recognize their loved ones and enjoy themselves versus those who age and are struggling in the throes of dementia. So this video is being put together and shared with you in order to free all of our minds from the shackles of dementia. So let's talk about Alzheimer's a little bit. Alzheimer's is a common type of dementia that basically that is basically caused by the buildup of different products, or what we could call debris, in the brain. One thing that you all have to understand is that our brain works very closely with our immune system. In fact, the brain has its own special immune system, and that system is there as our own personal army. Most people are aware that our immune system helps us to fight bacteria, viruses, and things of that nature, but don't really understand the intricacies of our immune system. So our immune system has many levels of responsibility, and one of those levels is to keep our brain pretty much free and clear from plaque and different metabolic debris that can build up over time. Now, one thing that we have to pay attention to when talking about Alzheimer's and why some families see it and some families don't is our genetics. Everything that our body does is based on our genetic code. Whatever information lies within our DNA kind of dictates the functions of the body. So some people carry genes that unfortunately create a problem in the area of cleaning that debris out of the brain. Some people are more prone to developing Alzheimer's disease because they carry genetic abnormalities that interfere with their body's natural ability to rid the brain of some of these toxic substances. So for those of you who know that you have a family history of Alzheimer's, it is possible to have genetic testing done in order to determine if you carry a gene that would make you have a higher risk of developing Alzheimer's. And so when we talk about prevention, obviously there are two major risk factors, that increase the incidence of Alzheimer's, and they are aging, which obviously we can't prevent that, and also our genes, our genetic makeup. So if you can understand that, you can also understand that there are some things that we all can do despite the fact that we're all going to age, and despite the fact that some of us may have some genetic predispositions. There are some things within our willpower to control in order to help decrease the rate of progression and the incidence of Alzheimer's disease. So now we're going to switch gears a little bit and talk about our nutrition, because talking about nutrition is a major area of prevention of Alzheimer's disease. If you want to be able to preserve your brain function and not go through life struggling with this disease process, you have to be more mindful of what you consume. So one of the biggest areas of our food that causes inflammation in the body is sugar. Those individuals who have diabetes and who regularly consume high levels of sugar are for sure putting themselves at risk for the development of different types of dementia. And let's be clear, you can have more than one type of dementia. It is not uncommon for an individual to develop Alzheimer's and vascular dementia. As a matter of fact, some people can show signs or have some of the damaged areas of the brain that we see with Alzheimer's. However, their symptoms are made much worse when their cardiovascular system is not healthy. So when we talk about our plumbing system, which is the heart and our blood vessels, and it carries blood to all parts of our bodies, we have to make sure that we are aware of the damage that both diabetes, high blood sugar levels can have on that system, and what that will do to the functioning of our brain. I also want to talk about inflammation for a minute. Some of us are familiar with the term itis. Any clinical term that ends in itis is identifying some specific type of inflammation. So allergies, sinusitis, arthritis, those types of terms indicate inflammation. And anytime our body is inflamed, our immune system is not in good shape. It's almost like you've tapped into your army, and your army is trying to attack something, and it ends up attacking some of your own good structures that you need in order to function. And a lot of times when we are not careful about what we consume, we can increase levels of inflammation everywhere in our body, and the central nervous system, the brain, is not exempt. And so some of the symptoms of other mental disorders that we see, or disease processes like depression even, can be caused by underlying inflammatory conditions that need to be treated. One of the most toxic substances that exist in the American diet are bad fatty acids. So it's really important for us to understand that in order for neurons to function well, we have to stay away from vegetable oils. We have to stay away from oils that our bodies are not able to process appropriately and get more good fats into our system. Good fatty acids actually improves neuron function. Our neurons are highly dependent upon that part of our diet. We also need folate. We need magnesium. We need our B vitamins. These are all other components of a well-functioning central nervous system. We have to make sure that we incorporate in our diet green leafy vegetables that will give us a lot of these nutrients and become less prone to eating foods that are damaging and dangerous for our entire bodies, including the brain. There's a great book entitled Why Isn't My Brain Working by Dr. Karazian. I highly recommend this book because it explains a lot of the metabolic processes that occur in the brain. It's impossible to really understand dementia if you are not familiar with all of the ingredients, if you will, necessary to maintain a healthy functioning brain. So for those of you who appreciate this message, learn something from this message, I would like you to pass it on. Please be sure to also note and understand that maintaining low stress levels and exercising on a regular basis, which allows good oxygen delivery to the brain, is also key to maintaining healthy brain cells. Please do follow me, Natasha T. Gettings, MD, on Twitter and Instagram. Please do visit my website, clarionconscience.com. All of these videos will be uploaded there for your review at your convenience. I want to get the word out that we can take care of our bodies. We don't have to continue to contribute to these growing global epidemics of disease processes that are preventable. I know we've talked about genetic predispositions, but I want everyone to be aware that what we do to this every day, how we choose to or not to take care of it, will determine our quality of life in the long run. I want everyone to go out and enjoy your weekend, share a healthy message with someone, and meet me back here next week as we explore more topics related to brain health. Thank you and be well.